Sir, I came across a patient in the OPD. She was taking the haloperidol antipsychotic and
Okay.
she presented with the symptoms of neglectoria. What's the pathophysiology behind?
Okay, look. While in psychosis, we give drugs like haloperidol, they are antidopaminergic. And when we go towards the hypothalamus, a substance is secreted from the hypothalamus, which is prolactin inhibitory factor, and it's actually dopamine. It inhibits prolactin secretion from the anterior pituitary. As this drug is antidopaminergic, the patient will have increased prolactin secretion due to the inhibition of PIF. And yet again, this patient will also have features of Parkinson's disease, or you can say Parkinson-like features this patient will have.
Sir, the patients with Parkinson who
Mhm.
are taking the dopaminergic drugs
Mhm.
may present with psychosis.
Yes, because these both drugs are on the two axes, for psychosis and Parkinson's. For Parkinson's, we give pro-dopaminergic drugs, while for psychosis, we give anti-dopaminergic drugs. So, yes, definitely, they can overlap as they are on the opposite axis.
And why we use the dopamine in the patients with the terminal illness or in the shock?
In terminal illness or shocks, yeah, look, dopamine increases the chances of the patient survival from a shock is by increasing the contractility of the heart, causing peripheral vasoconstriction, because it's also acting as a sympathomimetic agent in the sympathetic system.
May you please summarize the overall effects of dopamine in the body?
There are a lot of effects of dopamine in the body, but you can just come to 3 points. First of all, look, in the basal ganglia, dopamine is acting as an inhibitory neurotransmitter from the substantia nigra for the motor supply of the body, while in the hypothalamus, it's acting as prolactin inhibitory factor to decrease the secretion of prolactin, while in the sympathetic system, it acts on the alpha receptors, the beta receptors, and the dopamine receptors. So it can be used as a sympathetic agent for the body. That's why we can see in low dose, dopamine is given in the patient of renal failure, and in intermediate dose, it can be given to a patient of cardiogenic shock. And for peripheral vasoconstriction in a circulatory shock, the patient can also receive dopamine in higher doses.
Thank you so much, sir.
Yeah.